All right, so you're welcome to this webinar. As you all know, the World Health Day 2024 comes up happens to fall on Sunday, which is the 7th of April. And so to that effect, we put together this webinar to discuss the topic for the World Health Day, which is My Health, My Right. So thank you for joining us again. My name is Tijesu Ojumo, Communications Coordinator with eHealth Africa, and I'll be your moderator for today's webinar conversation. The World Health Day theme was chosen to champion the right of everyone, everywhere, to have access to health services, education, and information. Also, everyone has a right to safe drinking water, clean air, good nutrition, and environmental conditions, and freedom from discrimination. All of these things have significant impact on human health. And so because of this, we have put together in collaboration with EHA clinics, this webinar titled My Health, My Right, Prioritizing Wellness. The goal of this conversation this morning is to expose everyone joining us right now and those who will listen afterwards to the best healthy decisions for better physical and mental well-being. And the webinar will also elevate your understanding, my understanding of what it means to prioritize wellness. Our panelists today are people who have dedicated their lives to promoting and ensuring physical and mental well-being of people across the globe in their own respective fields. So I'm going to introduce our panelists to us in the next few minutes, and in no particular order. So the first on my list here is Nwogu Jovita. She's a dietitian with Cooked Indoors Medical Nutrition Limited. Jovita is a self-motivated registered dietitian. She is a professional with great passion for adequate nutrition in assessing, diagnosing, evaluating, and managing clients on various diet-related health conditions. Jovita has over 5 years of professional experience in a variety of settings, ranging from hospitals, NGOs, and even the food industry. Ladies and gentlemen, let us welcome Jovita. Jovita, can you please say hi to our viewers right now?
Hello, everyone. Welcome. Thank you for joining us.
All right, thank you very much. Can we see your face clearly? I think you should move back a little bit so that people can see your face. Oh, awesome, awesome. All right, so that's the beautiful Madam Jovita. Thank you for being with us this morning. All right, so the next person on my list here is Mr. Olumayokun Okunu. He's a fitness expert and prefers to be referred to as Mayo Okunu. He's the Chief Executive Officer and Minister of Fitness at the Body Rocks Fitness Studios. Mr. Mayokun is the creator and Chief Executive Officer of Body Rocks Fitness Studio, which is a remarkable feat considering his non-athletic formative years. Mr. Mayokun dedicated his time towards understanding the human body, and with the scientific mind, catalyzed his approach towards health and fitness. He facilitated his first Body Rock studio space in 2013 in Sunderland, and in just over a year, opened the second fitness studio at the Silverbed Center, Abuja, Nigeria. So when it comes to fitness, this is someone you want to hear speak to you. Hello, Mr. Mayokun. Good morning, and thank you for being with us. Can you please say hello to our audience listening right now?
Good morning. Thank you very much for having me. I'm very excited for this webinar. I can't wait to share some information and knowledge with everybody. Thank you.
All right. Thank you very much. And finally, last but not the least, we have Dr. David Ashem Shaibu. He is an Assistant Practice and Quality Assurance Manager at EHA Clinics in Kano. Dr. David is a distinguished medical doctor. And like I said, as Assistant Practice and Quality Assurance Manager at the EHA Clinic in Kano, he has a wealth of experience from medical and surgical practices spanning over 5 years. Dr. Hashem is a seasoned public speaker and administrator, He's committed to promoting mental health awareness. He has served in various capacities in the healthcare industry and is a vocal advocate for safe, patient-centered healthcare delivery. Hello, Dr. David. Can you please say hi to our listeners?
All right. Hello, good morning, everyone. I'm excited to be here today. Thank you so much.
All right, thank you very much, everyone. I'm looking forward to a conversation in the next few minutes. However, before we dive into the conversation, we have a short video from our IT department. And once the video is done, then we can get into the meat of today's conversation. All right, so cue the video. Thank you.
We join the world to champion the right of everyone to quality healthcare services. Of course, our health is our right.
Oh yes, access to safe drinking water is my right. So I stay hydrated by drinking more than 2 liters of water daily.
I schedule periodic health checks to address potential health concerns. Of course, my health is my right.
Of course, my health is my right. I keep fit with constant exercise every day.
My health is my right. That's why I wear a face mask, because I deserve clean air.
Of course, my health is my right. I eat a balanced diet every day with enough fruits. Oh yes, my health deserves good nutrition.
Of course, my health is my right. I take at least 5,000 steps every day to improve my physical and mental health.
Take charge of your health. Prioritize self-care. And remember, your health is your right. Happy World Health Day.
All right, thank you very, very much, and welcome back. I'll say I like the passion with which the last man in the video said, "Take charge of your health." And if you're joining us, I hope you heeded that key message to take charge of your health. If you're just joining us, you're welcome to this webinar put together by eHealth Africa in commemoration of the World Health Day. And the theme of our discussion today is My Health, My Right, Prioritizing Wellness. We have introduced our 3 guest speakers, and they will be presenting to us even now. So I'll welcome Dr. David to give us his presentation. Dr. David, you have the floor.
Hey, thank you, everyone. Thank you very much for being here today. I'm excited to be here, and I'm excited to have the opportunity to present something on general health as we mark the World Health Day. So I'll quickly share my screen, and then we can dive right in. Okay. Okay, just a second. Yes. Okay. I don't know, please, can you see my screen?
Yes, we can. Yes, we can.
Okay, great. So we'll be looking at general health today, and I would want you to dive in with me. Let's learn a thing or two about general health. So shall we? Okay, so let's look at general health. We'll be looking at it through the following contents. We'll be looking at the introduction. We'll have a look at the wellness continuum. We'll look at the concept of health, and then look at why is general health important? How do we maintain this general health? And then we'll look at EHA clinics and what it offers. All right, so yeah, so by way of introduction, I was able to look at famous quotes, about health in general, and I picked a few so that I could share with you today. We have a few from here, and this is from Mahatma Gandhi. He said, "It is health that is the real wealth, and not pieces of silver or gold." Do you agree? I feel like he really did well with this comment. And it is true, because health is the real wealth. If you want to define wealth, wealth is like a valuable possession, you have. either have a particular desired thing, or something you long for. And when you have it, you're wealthy. So I like the fact that he did not say wealth is money. Money is just a kind of wealth, So it is the truth. Health is the real wealth. Without health, you won't think of earning, you won't think of working, you won't think of hustling, you won't think of making a living, you won't think of silver, you won't think of gold, you won't think of money, right? As a matter of fact, these things are the ones you use to service health. You use it to make sure that you're back to full fitness. When there is a problem, what do you use? You use money, right? But you have to be wealthy. You have to be healthy to be wealthy, right? You have to be healthy to have pieces of silver or gold. So I feel like Mahatma Gandhi really did well with this. And Thomas Fuller said, health is not valued till sickness comes. A lot of people don't understand, don't prioritize, don't take charge. They don't really understand that health is important. They don't value it. They don't even know it's wealth, until sickness comes. I was having a conversation with a friend one time, coming to Nigeria now. I was having a conversation with a friend one time, and he said something that I would never forget. He said, health is not everything, but when it is absent, nothing else matters. The truth, it's not everything, but when you don't have it, nothing else will matter, right? And so it's very valuable. It's unfortunate that we only think about it when sickness comes. When you're ill, then you remember, look, I have to take care of my health, right? Now, look at what Buddha said. He said to keep the body in good health is a duty. Otherwise, we will not be able to keep our minds strong and clear. Now, this is clearly pointing to the fact that it's your duty to take care of your health. It is your duty. We understand from the theme, of World Health Day, say my health, my right, right? But I want you to understand that it is your responsibility to take care of your health. It is something you have to do. You cannot be passive about it. You cannot be just anyhow about it. You need to prioritize this thing because you are the first person, to be hit when there is sickness. Okay, so it is you that is having the duty to take care of health, keep it good and not poor. Now, there was something I said one time, and I had to put it here. I said, you are the first, you are your own doctor. You are first your own doctor. And that's true. Because if you take care of your own health, you won't need to go to a hospital. Taking care of your health already makes you a doctor, right? So you are first your own doctor, okay? Understand that it is your responsibility, like we've been saying earlier on. Now, taking the definition from World Health Organization of 1948, right? It says it is the attainment, health now, is the attainment and maintenance of the highest form of mental, physical, social well-being, and not just the mere absence of disease or infirmity. This was in 1948. But I want to point out the fact that a lot of people get stuck in that mere absence of disease or infirmity. Some people just feel like until I am ill, if I'm not ill, I'm fine. It may not necessarily be true. There may be illnesses that have not yet started showing symptoms, but they're there. There may be illnesses that are just there masking, as if you're fine, but you are not really fine. There may be illnesses that may be there, but because you haven't checked, you really don't know. So if you do not prioritize health, if you do not take charge, like it was said in introductory video, if you are not responsible for your health, things will happen and you will not be aware because you didn't have symptoms. Until later on, when you now begin to have symptoms, or later on, when you begin to have complications of that illness, then it will now dawn on you, look, I need to be fine. I need to be fine. But no, it shouldn't be that way. From the very beginning, you should understand that prioritizing wellness should be a thing for you. It's funny how a lot of people just wake up every day and just live life passively. You just do wherever you want, however you want, whenever you want, and you don't think, on the side that, look, I have to maintain. I have to make sure that I am fine. Otherwise, nothing else matters. I have to make sure that I am okay. Otherwise, all these other things I'm chasing, I won't be able to. right? And that's why I say my health, my right. But attaining and maintaining it, it's actually your responsibility. And nobody will do it for you, really, right? You have to. You're the one that will tell yourself, look, I'm going to have good diet. Look, I'm going to exercise. I'm going to drink water. I'm going to make sure I manage my stress. I'm going to sleep adequately. I'm going to do routine checks. I'm going to vaccinate. These are things you're going to do. And these things I mentioned, a lot of it don't cost money. And that's why I said you are first your own doctor. A lot of it don't cost money. There are simple things that if you bring a lifestyle, gives you health. Somebody say, how do you buy life? I will tell you the only way to buy life is to maintain good health. That is the currency for long life. Good health is the currency for long life. You want to live long, you need to have good health. That's the truth. Okay? Now, looking at wellness, wellness is an active process of growth. Okay, understand it's an active process. We've been talking about the fact that it's not something you do passively. It's not something you're reactive about. You have to be proactive for health. And it's associated with actively pursuing activities. I just mentioned a few. Making choices. You have to make choices. Lifestyle changes, controlling risks that could harm you, focusing on nutrition, having balanced diets, and following practices that lead to holistic health. These are things you have to do. You see that all these things that we mentioned just now, none of it is reactive. You have to be proactive to these things because you are prioritizing wellness. You want to be fine, and you know nothing else matters if you're not fine. We won't be here if we weren't fine, right? Now, components of health basically, see, it has to do with the physical aspect, mental, social, and even the spiritual aspect. So, of course, spiritual health is important. It gives you a clear mind, and makes you strong. Okay, like we saw, like by Buddha earlier when I was giving the first comment. Now, the next thing we're going to look at now is the wellness continuum. What is this? This is a spectrum. Where is a spectrum? It's like two ends, okay, where we human beings swing to at any given time. You can swing towards the right, you can swing towards the left. But I want you to place a close attention to the ends. What do you see? On one end, you see optimal health. On the other end, you see premature death. Do you see that? It didn't just say death, but it said premature death. Now, look at in between. You can see like a black area telling you disease is developing. If you go towards that end, if you go towards the other end, you see wellness developing. And in between, we have the comfort zone. This is where we swing to at every point in time. We just move this way, right? Look, a lot of people, now look at it, 0 to 10. Now, a lot of people are in this comfort zone, and the comfort zone is also known as false health. What is in false health? Look at under, you see neutral, right? In this neutral aspect is where you see you don't have symptoms, nutritionally inconsistent. I don't have any symptom. There's no headache. There's no body weakness. I'm fine. I'm great. But there are diseases that actually do not start with symptoms. There are diseases that are caught when you just do a routine check. For instance, hypertension. You can just go and check your BP and you just discover, it's high. Oh my God. You didn't know. Somebody hasn't visited your clinic for 5 years and it's like, I've not even had to take Panadol for headache once. And they're clapping for you. Yay, 5 years. You didn't go to hospital. You just go once and then you discover you have hypertension. And don't be surprised. That thing has been there for a long time. Now it's 5 years. Nothing was done. Right? Now it's tilting you towards complications because it has been there, nobody checked. 5 years, you didn't have to take Panadol and we are clapping for you. Yay, you have done well. No symptom, neutral, and you just have the illusion, I'm just fine. I'm good. Well, sorry to say, it may not be the case. And this is the problem. It's called false health. Look at you're nutritionally inconsistent. Today, you're like, okay, I will eat balanced diet. I will eat good food. The next day, you are... you have jumped out of the bandwagon. No, so of course, everybody, we must chop life. We must enjoy. We need to flex. That's fine. But you see, you are inconsistent, and it takes a toll on you. Okay, there was something Hippocrates said that I want to share. He said, "Let your food be your medicine, and let medicine be your food." That's Hippocrates, right? Talking about nutrition, and it's very important. You should know this, right? Nutritionally inconsistent is a risk. And look at where you are. You say, I ate this, I'm fine. There's no symptom. You're good. Exercise, very sporadic. It's only as the spirit leads you.
or somebody ginger you, or somebody press you, or somebody says something like that, or you check your weight and you see that you're not going overweight, you say, let me go back to the gym. It's very important. Then you now go, spend 2-3 days, you have come back to inconsistency. You are now sporadic, you're adding the weight, you are eating anyhow, right? That is where you are, neutral. Look at, at this point, people who are neutral, health is not a high priority. They don't care until they have headache. They don't care until they can't move. They don't, even with the headache, they will still drink Panadol. Life continues, man. We hustle, we roll. That's how they do. Okay? No sense of no urgency to the thing. You don't prioritize it. You don't know that this thing is precious. It can go. Okay? Every day you come in contact with people, so you get exposed to all kinds of things. When people talk, and I wish I could tell you how much of things that come out of people's mouth when they talk. So when you come in contact with these people, imagine what you're taking in. When you have to go through the day, imagine how much stress you get. Yet you won't take care of yourself. Yet you won't prioritize your health. Yet it doesn't mean anything to you until you're ill. Right? Look at the neutral people. After something small hits them, they go closer to poor health. Can you just take your attention to poor health? You see, it's close to neutral. Now you are going to disease developing. That's when you now develop symptoms. That's when you now have to start taking drugs. And if the disease is so bad, that's when you now have to do surgery. And then you begin to lose your normal function. Some people get so ill that they do not come back to the way they were before. For instance, if somebody who has been having hypertension for years, I say I didn't have to take Panadol for anything, and didn't know he had, and then comes down with stroke, you may never be able to be full functioning as before. You may now need to be lying down on the bed, half of your body paralyzed, and they're massaging your body. They are calling physiotherapists every 2 weeks to come and touch your body. Then they are now packing your pee and packing your, this is something that shouldn't get to this point. For me personally, I think that every chronic disease that one has should not be a problem. Once you have a chronic problem, you prioritize it and take care of your health. If you don't have, good and fine, but that's perfect. You don't need to tilt towards this place. And that's because you're not prioritizing it. You must move from neutral to poor health. It's not, you will just move. It will move you if you do not even move. From neutral, you will go to poor health. And from poor health, you will go to disease that have to do with multiple medications, poor quality of life, potentials become limited, body has limited functions, and if care is not taken, premature death. But think about it. What if you decide to imbibe these steps that we are going to talk about when we talk about maintaining health, and when the Minister of Fitness himself, Mayo talks, and then when the dietitian talks, when you talk about it, when you're able to imbibe these things, then you begin to move from neutral. Now you are now okay, prioritizing it. It makes sense to me. It is the first possession I have. I should make sure it's guarded with all jealousy. I must make sure I'm fine. When you begin to do those things, look, you get to good health. That's why you talk about regular exercise, good nutrition, wellness education, minimal health interference. You're not having any issue. You know how to distress. You know how to sleep. You know how to rest. You eat good diet. You're fine. Then from there, if you keep going, because like we said, it's an active step, it's something you have to do proactively. Then you get to the higher level. And the point is getting to the higher level. That's why the WHO said it is the attainment and maintenance of the highest level. That means that end. Look at that end. That has 10. That has optimal. That's where you should be. That should be your target. That should be your goal on a daily basis. If you wake up and say, I want to eat, I want to go out, then come back, go to the market, then go to church. Then if that is your plan, also have, I want to take care of my health. That should be there. It should be prioritized going forward because you can't afford to lose it. Okay? I believe you understand the wellness continuum now. Now look, it's for you. We understand that if you look at the reactive area, which I told you that will take you towards premature death. You look at the proactive area that will tell you, take you towards optimal health. You see, in reactive area, you should move away from just, hey, it's only when I feel better. If I've treated it, I'm fine. I'm okay. No, it should not be that way. You should not be corrective-minded. You should be preventive-minded. You should not be episodic. It's only when they talk to you, then you will not change. It's only when your weight has increased, then you will not add more fire to exercise. No, right? You should not be clinically responsible. Like I said, you are your own first doctor. You are the doctor of yourself first, so you should not be waiting for hospital. The responsibility for hospital is to help treat you. But it's not their own responsibility to make sure you remain in health. It's your own responsibility ab initio to make sure that you're fine. Don't compartmentalize your life. Look, there is this life, then my health is like this. Then no, integrate health into your life. Let healthy living be a lifestyle completely. We want you to thrive. We want you to maintain and improve yourself. We want you to think holistically about health. And you can only do this if you are proactive. We can only do this if you're preventive minded. That is the way, that's the wellness paradigm. Okay, that's the wellness paradigm. You cannot be moving to only medical and be neutral. It's all neutral. Anyhow, life, anything, something must kill a man. It shouldn't be that way. Okay? Now, if you're just something must kill a man, you'll be like this car. Look at this car. Okay? This thing must have been showing this guy on the dashboard signs. He must have been having signs, just like when you see on the dashboard. If something's wrong with the engine, you will see. If something's wrong with the light, you will see. If your brake is even on while you're driving, you will see. There's so many things you see on that dashboard that give you warning that, look, this car may break down. That's the same thing that happens to a lot of people. You see your weight has increased. We're living life, right? You have occasional chest pain. No, I can't. No, come on. You're fine. They're telling you, don't take alcohol, don't smoke. No, I mean, what is life if we don't chop life? Really? Okay, you become a discard. And when you become a, you've broken down, you now need help. That's why relatives will be calling. You say, this man is calling help. That's how relatives will now be looking for money to help take care of you in the hospital. That is how it will cost you so badly because you have to treat. Now, it's no longer broken down. It's a complication. It's so bad. They're now calling and calling, hey, please come and help us. So our brother is in the hospital. He's admitted. They say his kidney is not working. He needs dialysis. They are feeding him food through the nose with tube. They put catheter for him. He cannot move. These are the things that are, and you'll be broken down completely, right? Because you're not prioritizing it. It's not something you're thinking about actively. Don't be like this car that will stop on the road. Let me ask you a question. Have we ever traveled? This is for Nigerians, I'm very sure we've experienced it. Travel long distance journey, right? And while you were in the car broke down by the side of the road. How did you feel? Oh my God. Imagine it's a time where they are doing kidnapping now. They now broke down around Abuja Kaduna Road in the evening, 7:30. No light. How would you feel? That's the same thing with a lot of people. You see how you thought about it and you're like, oh my God, that's the same way it should be. When they're telling you check and prioritize health, you're refusing. No, I will not do. You will break down. No, when that can break down on that roadside, think about all the fear and anxiety. Think about, the fact that you'll be wondering, this driver did not check this thing before now. You think now this driver is, this guy's over, look at this engine. It wasn't checked. Things like that. That is when you'll be wondering, it will cost the driver. It will cost you your time. Fear, they may not even put you in another car. You have to use another of your finance to get another car to leave that place immediately. Or you go and load in the neighboring village until they fix the car. Right? Because you didn't take care of it. Right? And that's the problem with we Nigerians and we and people in general. You just so reactive. You just so until it's spoiled before we correct. You'll be like this car. Now, like that car that is on the road, this is the next thing that will happen to that car. Look, they have to tow it. Is it not true? If they're not able to fix it, they have to tow it to a mechanic. Now, let me shock you. That is how do we tow you with ambulance to hospital if you're not taking care of your general health. That is how do we carry, ambulance, they will call ambulance. These things are things that they're not expensive to maintain health. Really. It's just some consistency and the mindset. You should actually change it. Otherwise, this is how they will carry you to hospital. Because you are broken down. The body is a complex machine. You think about how a car functions. What is a car? How much more the body, right? And that's how they'll carry you. Okay? Concept of health, really. Concept of health, we have the biomedical concept, ecology, social, holistic concept. Now, biomedical is just talking about the germ theory. Like a lot of people think, until there's a disease, I'm fine otherwise. Until there's germs, you just believe that your body's machine. If it breaks down, it's only because of disease. That's biomedical concept. It doesn't really capture other aspects. It doesn't capture social, cultural, psychological, okay, financial. It doesn't cover all those aspects of health that can actually cause problems. And that's why it's one-sided. Look at ecology. Ecology is all about dynamic equilibrium, say man and his environment. Anytime the environment changes, then I'll be ill. Have you heard of people that say, when the weather is cold, that's when I used to have malaria. But then people say this, see, I'm not feeling fine. It's because the weather has changed. Have you heard that before? You're ecologically thinking. You're just thinking, okay, it's only because of that. Some people think that it's only because of when these environmental changes happen, that's when your man falls ill. But that's not actually totally correct. Psychosocial. Some people think it's only something wrong with your brain. It's in the mind, man. If you're fine in the mind, then you're fine. If you believe it, that's okay. But there are many other factors. The idea is for you to think holistically, that you merge all these concepts and understand that, look, these things affect health. My environment can affect my health. My psyche can affect my health. Okay, microorganisms can affect my health. Okay, it's a compendium of everything. Consider all the factors and be proactive towards preventing these things that can cause problems to you. That's basically. Now, I took this so that you can understand the burden of diseases worldwide. Can you see? There is one guy here that is so bad. Look at hypertension. You see, 73.9%. This is the commonest. Look at it, chronic problem in the world. As a matter of fact, you see this hypertension and its complications is the cause of 25% of death in all women worldwide. Hypertension, it doesn't have symptoms, please. It doesn't have symptoms. In fact, it's asymptomatic until you start having issues, right? If you do not check, you will not know. Look at diabetes, the same thing. Until you do a check and then you say, blood sugar is high. Blood sugar is high. But I've never, and you never went to the hospital once. So how long has it been high? You cannot tell. You cannot tell, right? And a host of others. But you see this bad guy in hypertension is bad. And you cannot know until you have annual checks. You cannot know until you have routine checks, right? So please, it's time for you to let go of that. Anyhow, let go and be more, proactive about it. Now, what's the importance, okay? To prevent disease occurrence, to ensure a significant reduction in vaccine-preventable diseases worldwide, you want to promote health. That's why you're trying to make sure health is a concern. You want to reduce the burden of diseases and deaths worldwide, and you want to reduce the cost of health. I told you how much it will cost you to do something, right? Yeah, that's it. So, how do you maintain it, right? I talked about what Hippocrates said. Let your food be your medicine, and let medicine be your food. I'll leave it for my dietitian to talk about this more, and then exercise regularly. I'll leave it for my minister of fitness to talk about this more, right? Regular sleep, very important. Some people don't sleep. You carry work left, morning, night, something must give. You should learn to get regular and adequate rest. These things don't cost money. Look, you can have a look at the list. It doesn't. You should have adequate time to rest. Please. Some people who want to sleep, they put their phone on vibration or loud, ring loud, so that when they chat, you hear it. When you hear that iPhone, ding, you now stand up, respond to the chat, then drop the phone. And when they ask you, how are you doing like that? You don't have sleep hygiene. Leave this thing. Drop the phone, get some sleep. It's not needed.
Sorry, right? Dr. David, sorry to interject. I just dropped my phone. I just dropped my phone now to like you have advised. So I just wanted to remind you of the time. Okay. So that we can have a wonderful presentation, sir. Thank you.
Yeah, I'm rounding up. Thank you. I'm already. Thank you so much. Yeah, you need to know how to manage stress. How do you de-stress? How do you relax? Right? Do you? Is it yoga? Is it deep breathing? Is it music? Is it movies? Is it sleep? You should know it and do it as often as possible, especially when you feel stressed. Take care of your mental health. Take care of your mental health. If you have problem with mental health, if you're too stressed out, you're burnt out, please know. The doctors in EHA clinics, we are trained for mental health issues. And we have specialists for this as well. If you feel like you've been having persistent sadness, you feel like you're having symptoms that in keeping with depression, anxiety issues, and all other mental health issues, of course, know that help is not far away. You're just a knock away, a phone call away, you're an appointment away from getting help that you need. So please prioritize your mental health as well. Practice good hygiene. Stay hydrated. You heard it earlier on. You should drink 2 liters of water. That's 8 glasses a day. It's so difficult. People only drink water when they eat. Only when they eat. And even in the eating, you must be thirsty first. You must be pepperish. then you will drink water. Why? And you're waiting till your test. The test, you know what is test? It's your body shouting that it needs water. Ideally, you shouldn't get to that point. You should drink water often. You don't need to wait until your body is now giving you signal. Okay, you drink water, then you now drink. Okay? Avoid harmful substances. Alcohol, excessive alcohol, not good. Really not good. Okay? Smoking, other substances, not good. Stay active. Get regular health checks. Please get health checks. Please get health checks. Check. You will not know until you check. 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 Tell yourself check. You need to check, right? Yeah. No, so EHE clinics. This is a clinic in a nutshell. Comprehensive world-class healthcare organization established in 2018. And these are our values. But what do we offer most importantly? Okay, routine annual health checks. Okay, so you can come in for a checkup, screening tests, just name it. Come in for a check. Okay, specialist consultation. I was talking about mental health just now, right? And others, a lot of them, they check. Chronic disease management, system. We have the very robust one for managing chronic disease, hypertension, diabetes, sickle cell. Even recently, if you are pregnant, you are one of us. Come, let us empanel you and check you. Okay. Immunization services. Imagine that I vaccinate, you vaccinate, everybody vaccinates. We'll be all fine. Really, we'll be fine. The whole world will be free of diseases. But vaccination, no, I refuse. Do this one.
2 more minutes, sir.
Yeah. Dental care, very important. When was the last time you saw it? When was the last time you saw the eye doctor? Okay. When was the last time you saw a dietitian service? Okay. Even if you want us to treat you at home, there's home care service. If you like sedentary lifestyle, you can relax, come and see you at home and take care of your mental health because we have mental health services as well. So you can see how this woman is doing well, right? You can see she's doing well. Don't jealous her because, look, she's fine. She has let go of all those things. Look at it. She's doing well, right? So yeah, thank you so much. I know I've taken a bit of your time, but I really appreciate the time you gave me to learn a thing or two. If you have questions, you can always, at any point in time, drop it answer. Thank you.
Thank you very much, Dr. David. If we're in a live event, I would have said we should give you a round of applause, but I think you can still do that if you think you have received very vital information. Please, if you have questions, put them in the Q&A box, and then we will take them at the end of the conversation. A few things that you've said, you are your first doctor. Let your food be your medicine, and let your medicine be your food. And I'm glad also too that you've brought our attention to what false wellness is. So it's important for us to. I think that some people will need to really go back and rewatch this segment again to really, educate themselves properly. But thank you very much, Dr. David, for that insightful presentation. All right, so I'm really excited about the panelists that we have today. The next person is a dietitian, as we introduced her earlier. Jovita, please, you can have the floor. Thank you. I think you're muted. Can you unmute yourself? I can't hear you. No. Can you speak again? Okay, yes. Yes, you're audible now. You're audible now.
Oh.
Yes.
All right, welcome to today's webinar. As earlier introduced, I'm dietitian Jovita. So I'll be taking us on about nutrition. So let me share my slides so that we can begin. Can you all see my slide?
Yes, we can. Yes, we can.
Okay, thank you. Okay, just like we all know, the WHO, we are celebrating, the theme for today is my health, my rights. So just like Dr. David has earlier said, so I wouldn't talk much on it, but I actually want to emphasize on something he has already said. He said, realizing the right to health means creating conditions where everyone can access quality health facilities, services, good nutrition, education, safe water, adequate housing, etc. So it's not just individuals, both the the government, the health workers, everyone is involved. So it's not just about individuals. And also the right to health is also a human-based health system. So when we want to ensure the right to health, we have to look at the access. Is the healthcare system accessible? Is it accessible for all? Is it affordable? Is it free? And because it's not everybody that can also afford it, that should be the duties of our government to also ensure that it's accessible for both the vulnerable groups, the pregnant women, nursing mothers, children, elderly, and also availability. It must be available. Is it acceptable? It has to be acceptable. You know, healthcare services must be respectful, non-discriminating, just like Dr. David has already said. It's not about, oh, this person is an Igbo, oh, she's an Hausa, she's a Yoruba. No, there's nothing like discrimination. Everybody has the right to health. Also, the quality of it, when it comes to quality, it is about standard, okay? Now, what's the standard of it? Just like Dr. David has said in eHealth clinics, you know, there is standard, there is quality. So he has already listed those ones previously. Then to adhere the basic human rights obligations, you know, there are some things that has to put in place, both the healthcare facilities and the workers. I've seen some places whereby some people will say, oh, I don't want to go to that hospital, oh, you know, the nurses, the way they talk to me, the way they treat people. You know, there has to be respect. It has to be two-sided. The patient respecting the healthcare workers respecting their clients. And also, there is protecting the informations. And for instance, in medical care, we talk about confidentiality, whereby you don't disclose a patient's information. You don't disclose the patient's information. For instance, the patient is HIV positive and he or she is saying, oh, I don't want people to know. At least it's your duty to protect their interests, okay? And then fulfill. It has to be adopted both by the government, everyone, the legislative. In fact, Zero Hunger, which is about nutrition, is one of the sustainable development goals. I think it's number 2 in SDG goals, 17 SDG goals that we have. Okay, so let's just go straight to my topic for today. That was just an introduction. It's about adequate nutrition for optimum productivity. You know, it's only somebody that is healthy. It's only when you are healthy that you can talk about maybe you want to go to work. For instance, if you're sick, you can't talk about going to the office. That should not even be your concern. So I want to get better. I want to be fine before I talk about going to the office or to the market or to the business place, anywhere you want to go. So consuming a healthy diet throughout the life course helps to prevent malnutrition in all its form, whether undernutrition, whether overnutrition. When I'm talking about undernutrition, I mean marasmus, kwashiorkor, marasmic kwashiorkor, then overnutrition, obesity, underweight. All of these are malnutrition in all its form. Okay, so when you don't consume the adequate diet needed, some people will be like, oh, what's adequate diet? I'm coming to that. You know, for an adequate diet, or for a diet to be adequate rather, it has to be made up of the 6 classes of nutrients. I'll still get to that, okay? So the exact makeup of a diversified, balanced, and healthy diet will vary depending on individual characteristics. What do I mean? For instance, a child that is 2 years, the recommended dietary allowance for a 2-year-old child cannot be the same for an adult of 18 years old. Okay, the gender too. For instance, females, like we say pregnant and lactating mothers, we encourage them to eat well, like the normal RDA for an adult is 2,000 kilocalories. But for a pregnant woman, she can go 2,500, 3,000 kilocalories per day because of what? She is pregnant. And then the RDA for men is not the same for female. So that's where gender comes in. Then degree of physical activity. If you're the kind of person that lives a sedentary lifestyle, if you don't encourage like people that, for instance, bankers or 9-to-5 workers, when they get to office, they sit down the whole day, they have their cars. Some of them don't even want to maybe trek to the bus stop or exercise later in the day. So they will just from office to car, from car to, to their house. That's just their lifestyle. So we consider those things before we know the kind of diet to place on. Then we also look about the locally available food and the dietary cost of these things are things we consider before placing an individual on a diet. Now, what comprises a healthy diet? Just like I said earlier, for a diet to be adequate or for a meal to be adequate, it has to comprise of the 6 classes of nutrients, which are the carbohydrates, the protein, the fats and oil, the fruits and vegetables, and water. Dr. David Avena stated about water. Some people will only drink water when they eat, while some people wouldn't drink water at all. Whether they ate or not, they are not drinking water. They will say, oh, I don't like drinking water. I want to take carbonated drinks. I want to take juice. Of course, juice is different from water. They are 2 different things. They can't compromise each other. Juice is juice, water is water. And we recommend water, not just juice. Okay, so some people will be like, what are the food sources of carbohydrates? When you talk about carbohydrates, you talk about your rice, your curry, your amala, potato, yam, plantain, name it. They are all carbohydrate foods. Then when we talk about protein, we have the first class protein and the second class protein. What do we mean by the first class protein? We talk about the animal protein, that first class protein. Egg, fish, meat, fish, snail, just name them. They're all animal protein and they're first class protein. While the second class protein are things like beans, soybean, and all that. Then the fats and oil, we recommend like soy oil, the ones that are polyunsaturated fats and oil, such as the soybean oil, olive oil, the sunflower oil, the canola oil. They are all fats and oil. These are the food sources of oil. Oil can also be found in nuts, like coconut oil too. It can be found in nuts. Then we go back to the fruits and vegetables. The food sources of it is the apple. For fruits, apple, mango, pawpaw, name it, there are plenty. Then the vegetables, we have the non-leafy vegetables and the leafy vegetables. The leafy vegetables are the ones like spinach, the one ugu, I don't know, the Igbos call it ugu. I think many people call it ugu, and then other leafy vegetables that are in the market, ewedu, all those ones are leafy vegetables. Then the non-leafy vegetables are like cabbage, carrots, cucumber, garden egg, tomatoes, onions, red bell pepper, yellow bell pepper. There are a whole lot of all of them. So those are non-leafy vegetables. Okay, now let's look at what comprises a healthy diet. Fruits and vegetables, legumes, nuts, and whole grains, all these are what comprises a healthy diet. So it's recommended we take at least 5 portions of fruits and vegetables per day. Okay, so excluding potatoes, sweet potatoes, cassava, those ones are starchy vegetables, so they are not inclusive. Okay, then it's recommended we take like 10% of our total energy intake. For people that take free sugars, when you talk about free sugars, we talk about table sugars, and also table sugars, drinks like fruit juices, artificial fruit juice concentrate, and all that, honey, syrups, they are all free sugars. So WHO recommends we take at least less than 10% of it in our total energy intake per day. So if there are special cases whereby an individual, for instance, a diabetic patient, is restricted from intake of a certain food, even though they are natural, so that's where we reduce to less than. It can be 2%, 3%, depending as the case may be. Okay. It's also recommended that individual takes less than 30% of total energy intake from fats. Like the fats we take, let it be less than 30% of it from fats. Unsaturated fats are not recommended, but saturated fats are not recommended. What are examples of unsaturated fats? I've listed them there. Fish, the nuts, the sunflower, the soybean, the canola, and olive oil. Like fish has oil, of course, so they are unsaturated fats. So the saturated fats, we talk about the fatty meats. Like some people will say, oh, they say we should not take red meat. No. If you want to take red meat, to take the lean part. What do I mean by the lean part? The part where there is no visible fat. There's no trace of visible fat. So that's the one you can take. So anything fatty meat, butter, palm and coconut oil, they are saturated fats. Even cheese and creams. And all kinds of trans fats are not allowed. Better industrialized produced trans fats, the ones we get in our fries, like meat pie, cakes, donuts, all those ones, they are industrially produced trans fats. Then the other ones are the ones gotten from ruminants, like ruminant trans fats, which can be gotten from cow, like the fats in cow meat, sheep, goats, and camels. So it is suggested that the intake of saturated fats be less than 10% of our total energy intake. And then for trans fats should be less than 1%. Okay, and then salt. It is recommended that we take at least less than 5 grams of salt, equivalent to 1 teaspoon, not tablespoon, 1 teaspoon per day. And our salt should be iodized salt, not just any salt we see in the market. We should, when we want to get our salt, we should look at the pack. Is there iodine in it? So is it iodized salt? So these are the things to look out for. Then let's go to the practical advice on maintaining a healthy diet. Okay, now we'll take the fruits and vegetables first. What do we need to do to ensure that we incorporate fruits and vegetables in our meals? Okay, so the things we need to do is eating at least 5 portions of fruits and vegetables per day. This reduces the risk of non-communicable diseases like obesity, cancer, diabetes, hypertension, and also helps to ensure adequately daily intake of dietary fiber. Like vegetable is rich in fiber, and most times for some people that have seen a dietitian before, maybe some people that want to lose weight and maybe they're diabetic, we'll tell them make sure you incorporate fiber in your food. So vegetable is also a rich source of fiber and is low in calorie. Vegetable is low in calorie, whether leafy vegetables or non-leafy vegetables. They're all low in calorie. Even if you want to lose weight, we encourage you to take more of vegetables than fruit. Okay, so what are the ways to reduce sugar intake? In aspect of fruits and vegetables, you take fruits, you eat fresh fruits and raw vegetables as snacks. For some of us that want to snack in between meals, maybe you're taking your breakfast, maybe around 8 and around 11, you want to snack on something. So it's advisable you snack on raw vegetables, like your cucumber, carrots, cabbage. It can be mixed vegetable, it can be single vegetable, and the fruits should be fresh. All these has to be fresh. Also, eating fruits and vegetables that are in season. Okay, for instance, this is the mango season. Mango season is coming up. It's encouraged you to take those fruits in season often, because before you know it, they'll go off season and you might not be able to see them. Even when you see them, it will be expensive, and most times it's not even accessible. You might not see it in all the places. Okay, so, and also including vegetables in meals, then eating varieties of fruits and vegetables. Variety means maybe you eat pawpaw in the morning, in the afternoon you can eat any other fruit, maybe pineapple, orange, mango, what have you. Okay, now this is about fats, because I'm taking them according to their nutrients. This is about fats. So reducing the amount of total fat intake to less than 30%, like I've stated earlier, will help prevent unhealthy weight gain in adults. Okay, so taking excess fatty foods every time you're frying your food, You want to eat meat, you fry. Fish, you fry. So it exposes, and for instance, if you get olive oil, like is a polyunsaturated fat, and when you fry it, you have turned that oil to a trans fat. It's no longer on its original state. You have transformed it, so it's no longer healthy. So that's why we encourage cooking. Instead of frying, you cook. Okay, then reducing saturated fat to less than 10% of our total energy intake, the trans fat to 1% of our total energy intake, then replacing both saturated and trans fat with unsaturated fats and polyunsaturated fats in particular, to be specific. Okay, so what are the ways to help reduce fat intake, especially the saturated and industrially produced trans fat? Like I said earlier, you can grill, you steam or boil instead of frying when you want to cook. Okay, then replacing butter with oils rich in polyunsaturated fat, such as the soybean oil, the canola oil, the olive oil. Then eating reduced or low-fat dairy products, fat dairy foods. What do I mean by low-fat dairy foods? When you want to take milk, instead of taking the whole, the whole milk, there's one we call full cream and the one we call low-fat. So instead of going for full cream milk, you go for low-fat milk. Even dairy produce like yogurt, there is low-fat yogurt, low sugar yogurt. They are all there. And then your meat, let the meat be lean meat. Or when you, maybe by mistake, you get a meat in the market and you're seeing visible traces of fat, you can just trim them. You can just cut them off, throw the fat away before you cook your meat. Then limiting consumption of baked and fried foods and prepackaged foods. Okay, then salt, sodium, and potassium. Salt is a form of sodium. Okay, so much people tend to consume a lot of sodium rather, because most processed foods that we buy in the market has a lot of sodium. Okay, for instance, the bouillon cubes, the one we use in cooking, the cubes we use in cooking, of course, is high in sodium. So when you're cooking and you're using like 5 cubes to cook a particular meal, so you're loading your food with sodium. So it is better you go for natural spices. So some people say, what are the natural spices? We have ginger, we have garlic, we have nutmeg. There are a whole lot. I can't start listing them. There are a whole lot. So you replace them with that. And then the salt intake. The salt intake should be less than 5 grams. That's 1 teaspoon per day for an individual. So if you want to know the salt intake or the salt or sodium content of the food, you read the food labels. For instance, you're going to a supermarket, you want to buy anything of your choice, you read the food labels, you see the sodium content. So you'll be able to determine whether this food is low in sodium or high in sodium. Of course, excessive intake of sodium is linked to high blood pressure. And then inadequate intake of potassium is linked to high blood pressure too. So the lower the sodium, the higher the potassium. So it's advisable to take less of sodium or salt in its form, and then high intake of potassium. Potassium can be found in fruits like banana, mango, even in vegetables too. They are all high in potassium. So it's better to take potassium than to take sodium. So little sodium, then more of potassium. Okay, what are the ways to reduce salt intake? By limiting the amount of salt or high sodium condiment, just like I stated earlier, not putting salt on the table. Some people, when they are done cooking, they will now keep 1 teaspoon of salt aside as they are eating their sprinkling. You are taking excessive intake of salt, and sprinkling it, you're taking the raw portion of it. It's not advisable. Then limiting consumption of salty snacks. Just like I stated earlier, you try to read the food labels to choose the products which are lower in sodium content instead of going for higher sodium content. Okay, sugar intake. When I'm talking about sugar, I'm talking about the free sugars, which we call the artificial sugars. Artificial sugars can be sweeteners, it can be carbonated drinks, it can be fruit juice. They are even linked to dental caries, and they also spike the blood sugar level. For some people that are diabetic, the sugar level is restricted depending on individual. So I can't say this is the amount take for diabetic patients. They are individualized, actually. So, but this is for a wealthy individual, apparently healthy individual. So we recommend less than 5% of total energy intake to come from sugars. Okay, what are the ways to reduce sugar intake? The ways to reduce sugar intake is just limiting consumption of foods and drinks that are high in sugar. Like I've said earlier, the candies, your beverages that are high in sugar, just like the carbonated or non-carbonated drinks, the fruit juices, the vegetable juices, most of them, those ones that are sold in the market that are not produced by yourself, all the ready-to-eat foods, they are all high in sugar. Then eating fresh fruit and raw vegetable as snacks instead of sugary snacks. Instead of going to buy, even for our children in the house, maybe you want them to snack. Instead of going to buy all those juice in the market, I don't want to start mentioning brand names. We all know, we understand better. Instead of buying them, you replace them with your fresh fruit juice made from the house. Then, or raw vegetable, they can, now you can just give them one cucumber or one carrot, you can slice it or dice it so they can be easy for them to chew because they are children. Even adults too. As you're packing your lunchbox, you're including your snacks. So instead of getting your meat pie or donuts or whatever have you, you just put your vegetables or your fruits. You can put a serving or 2 servings as the case may be. Okay. Okay, this is apparently how a healthy plate should look like. This is apparently how a healthy plate should look like. When we look at by the left side of it, you will see the green portion, which is written vegetables. Okay. So the vegetable, when you divide your plate into 2, let's do the practical aspect. When you divide your plate into 2, then the half of it, the upper part, that's 30% of your plate should be for vegetables, while the 20% of it should be for fruits. That is what comprises a healthy plate. And when you talk about the veggies, the more vegetables, the greater the varieties. Okay, and there is no vegetable that you say this one is more dense in nutrients. Okay, you can't say that this vegetable has it all. The more vegetables you take, the more nutrients you get. So it's advisable you take a varieties of vegetables and fruits. Okay, and it makes the plate colorful. Even if you don't want it, when you put fruits and vegetables, it can be put in the plate or it can be put aside. So it makes the plate colorful and more attractive. Then half of it, like the right-hand side, you divide it into 2. The upper part should be your whole grain. That's 25% of your plate should be whole grains. What do I mean by whole grains? Whole grains are like rice, whole rice, most especially the brown rice. And also we should limit intake of refined grains. Refined grains like white rice, white bread, even our swallow should be whole. For instance, if you want to get wheat, it's better you buy the wheat, you blend, you sort it out, you blend, and then turn it into swallow, rather than buying the processed one. Because the implication is the processed ones, most of the nutrients has been lost, especially the fiber content, it has been lost. So, but when you are buying it as a whole, as for instance, wheat, you're buying it as a whole, you're blending it, every nutrient is intact. There is no nutrient that has been lost. Okay, then we talk about the healthy protein, not just any protein, the healthy one. So what do I mean by the healthy protein? The fish, like I stated earlier, the beans, nuts, it can be coconuts, almond nuts, cashew nuts, granules. And then the lean meat of, if you want to eat red meat, let it be the lean meat. Then chicken, turkey, they are all healthy protein. Okay. Then water, I've stated earlier, as you can see on the upper part of this is water. So it's advisable we take at least 8 glasses of water per day. And then we should limit milk and dairy to 1 to 2 servings per day. A serving of a dairy product like milk is a cup. So we should reduce it to 1 to 2 servings per day. Even juice, 1 small glass per day, and avoid sugary drinks. Okay, then the left part of it, you see a healthy oil, the yellow part on top. So I've already stated that earlier. We should take the healthy oils and do away with saturated and trans fats and oil. In conclusion, achieving an adequate dietary consumption involves being intentional. You have to be intentional. You have to say, oh, today I'm going to start eating rice. You have to be intentional about it. It's not something that anyhow, let's just be doing like that at all. No, you have to be intentional about it. You have to make sure that all the 6 classes of nutrients are embedded in your meal, whether breakfast, whether lunch, whether dinner, your fruits, your vegetables, your whole grains, your healthy protein, your polyunsaturated fats, your water, they're all embedded in it. And this reduces the risk of cardiovascular and endocrine diseases such as diabetes and hypertension. Thank you so much for listening.
Thank you so much. That was very, very insightful. I think that from listening to you, you know, that our listeners must have really come to understand the gravity of what we take in, you know, what we eat, and its impact on the function of our body and our well-being in general. So I'm hoping that, you know, for those who have listened, both those following on LinkedIn and those on Zoom here, I'm hoping that you have taken in 1 or 2 things, or even much more than that. If you have questions, please put them in the Q&A box. I think that the question and answer session is going to be quite interesting. So please, if you have your questions, put it in the Q&A box, and when we're done, we'll take them. I'm excited about this next speaker. We've dealt general health. We just finished listening to a dietitian give us information about food, and now we want to talk about physical fitness. I think that this is one of the important parts of this conversation. A lot of us, you know, when Dr. David was speaking, it was like as if he was shooting guns, you know, bullets. I'm sure must have touched each and every one of us in different, you know, aspects. And also to while Jovita was speaking to, I mean, reading from the chat box, somebody was saying, I've gone astray from my diet plan, you know, and I believe, you know, we've picked things from the last 2 speakers. And now coming to fitness, a lot of us, you know, don't let me jump the gun. Let me open the floor to Mr. Olumayokun, the CEO of Body Rock Fitness Studios, to take us on this journey in the next few minutes. Mr. Mayokun, you're welcome.
Thank you very much. Thank you so much for having me. And amazing to have listened to Dr. David and Mr. Vida as well. That was really, really inspiring, and it was nice to see all those things put out there as well and to listen. So I can just share my screen now, yes? All right, great. Yeah, so like I was saying, so a lot of the things I was going to talk about today are actually been said already by Dr. David and Mr. Vida. So I'm actually just going to pass through all those bits and make this as practical as possible. I really wanted that by the time this is over, everybody who's listening, take something away from this and actually something they can use and apply to their lives on a daily basis. So obviously the theme that they were taking back your health, you know, my health, my right. And also trying to imbibe with as much fitness knowledge as possible. So that's an introduction of me. You all know who I am already. Okay, so I'm going to pass through nourishing the body because Javid has already done all of that. One of the things that I noticed I wanted to pick on, Dr. David mentioned, was using the analogy of the body as a car. You know, if you don't look after the car is going to break down, and the way your car gets towed away, the way your body gets towed away with an ambulance. So I like to use this particular analogy of imagining your life on a dashboard of a car. So your personal life, your work life, and your you life, things that you do for yourself. Most of the time, the way the world is now, it's become very difficult for a lot of us to to have a good work-life balance or personal life balance, just balancing things generally. I always say that balance is the ultimate maturity. It's one of those hard lessons you have to learn in adulthood. How do I excel in my job? How do I, keep making money? How am I able to be a good husband, father, wife, mother, even child, a good student? How do I do all these things? How do I excel in every single area of my life? Finding that balance. And even for myself as a fitness professional, I still have moments in my life where I will perhaps be putting a lot more energy into my personal life, and I'll see that I'm starting to fail, with my fitness life. I'm missing more sessions than I would in a week, and all those kind of things. So I can only imagine what that is like for the average person who's just trying to get by with everything else. So I'm here to give you little tips on the things you can do to secure that balance and to ensure that you're getting a little bit of everything, especially with your fitness life. So physical activity. So I have a rule that I ask everybody to follow. It's don't allow 3 straight days to pass without doing something consciously active. As human beings, we always like to find ways to excuse or justify our absences or our lapses. So you hear people say, "Oh well, I don't need to warm up for this exercise because I climbed up the stairs to get to your gym or your studio." So we're fond of doing things like that, and we do that. We bring that into our normal daily activities. And a lot of people will say, "Oh, I don't have the time for it." The truth is, you always make time for what is important. What is important to you, you always make time for it. If I call anybody up at 4 a.m. in the morning and say, "Hey, I have 1 million naira here waiting for you. You need to come all the way across states to get it," you will get up and you will come and get it. But if I called you and said, "Oh, come and work out with me," then the excuses start coming in. This, that. The thing is, if you want it, if you truly want it, you will find a way to make it happen. So just the same way we talked about, like Dr. David had mentioned, that you have to respect your body. You have to give value to your body. It's yourself. It's your health. And like all the greats, Mahatma Gandhi and Hippocrates are also put the analogy of how your health and your wealth go together and how you can't have one without the other, really. You can't enjoy your wealth, or you can't truly say you're wealthy if you're not healthy. If you're spending all your money on, trying to treat yourself, you can't, do basic things. Maybe you can't get up anymore. You can't speak coherently. You can't, play with your kids because you're overweight and your mobility has been hindered. Those are all the things that you need, you don't want in your life, so that you can call yourself a truly healthy and wealthy person. So 1 hour of a day is just 4% of the day. And I don't even request that from people. I tell people, I try to cancel every excuse that anybody has. A lot of people say, "Oh, I can't make it over to the gym. It's too far from my house." No problem. Some people say, "Oh, I don't have time. I wake up really early. I have kids to get ready. I don't have time." Fine, no problem. A lot of people say, "Oh, I can't afford the gym membership. All the bills I have already. Paying for a gym is too expensive." So the way to cancel every single one of those excuses is I've devised programs that are just 10 minutes every morning. You can get up and it's 10 minutes. 10 minutes is not too much to ask. If you have to wake up 10 minutes or 15 minutes earlier than your usual time to get it done, it's for you, it's for your body. And you have to reorient your mind about how you think about fitness. Fitness shouldn't just be, you shouldn't think of it as a chore. If you think of it as a chore, this thing you have to just get over, you're always good. Excuses are always going to creep in. There's going to be 1,000 reasons why you can do without the exercise today. But if you start to think of exercise like the way you think about brushing your teeth, it stops being a problem. Many of the women have no issue sitting under somebody's, sitting between someone's lap and getting their hair done for 6 hours of the day. They have no issue with that. A lot of, there's some men who cut their hair very regularly, maybe they're bald, and they have to cut their hair every 5 days or every week. There's no issue with that. And they spend 30 minutes at the barber. And everybody, every single one of us spends at least 5 minutes, sometimes even twice a day, brushing our teeth. So I like to equate your valuation of yourself and the importance of fitness to yourself as one of these tasks that you do every day. You brush your teeth every day, you have your bath every day. You should be active every day. It is one of the main characteristics of being a living being, movement. And that's all it is. I'm trying to remove all complications, trying to remove all excuses from this thing that is fitness, all of us, and just think about moving. I have a very interesting story about somebody who accidentally got fit. So he had a daughter who was in the learning stage or in the stage of counting numbers. So he was trying to help her count her numbers. So he decided to buy skipping rope, and both of them would now skip and count the numbers. Before he knew it, while he was trying to push his daughter to count 100, 200, 300, he found himself doing this skipping 300 reps every day. And he was shedding weight, and he was becoming fitter. His posture improved. His breathing was better. He stopped snoring at night. He had to change the entire wardrobe from something as simple as skipping. The thing is, all of us, as we get older, as we become adults, we start to deviate further from things we did in childhood. And the things we did as children are actually very, very important to our fitness health. Because as children, we were forced to eat properly. We had square meals. Our parents ensured that the meals we got were good, and the fast food and the sugary stuff were only as treats, But as we become adults, a lot of us now start to have treats as a regular thing. Those become the normal meals that we have. And then you having a good, wholesome, balanced meal, like Mr. Vida mentioned, will only happen once in a while, maybe on a Sunday. So this is a complete flip on the way we live our lives. Also, going from childhood to adulthood, a lot of us spend a lot less time outside, outdoors. As children, we like to go outside and play. We got sunshine, we got fresh air. As adults, we spend most of our hours in air-conditioned rooms, air-conditioned vehicles. We become more sedentary. There's more reliance on technology. And technology is not bad. It's not a bad thing at all. It's a true sign of progress in civilization. But we must allow these things to become tools for our own personal progress as opposed to weapons against our fitness. So a little advice I like to give people is try to fall back into childhood. Those things you do. So take a walk. You live in an enclosed estate, perfect. Take a walk around it, 10 minutes of a day, it's fine. A lot of us now have, when I mentioned about using tech for our own progress, a lot of us have smartwatches now, activity trackers. Our phones have health apps on them. All these things, we can use them for our own benefit. Use the health app, track how many steps you've taken in a day. Set a target for yourself. Am I doing 5,000 steps? Okay, naturally I do 2,500. That's pretty low. So my next target is to try and take that up to 3,000. Then after a week of doing 3,000, I want to move it up to 3,500, 4,000. All these things are progressive steps you can take to becoming more active and getting a better status in your physical fitness. Dr. David and Mr. Vida both spoke about sleep hygiene. So restorative sleep. A lot of us are completely distracted. See, once again, technology is acting as a weapon against us here. A lot of us have to press our phones. We're playing on our phones every time, and then it stops us from getting into proper sleep, getting deep sleep, getting enough sleep. Something else that we did as children. We were sent to bed as kids, bedtime. All of us as adults now, we're responsible for ourselves. How many of us actually have a bedtime? How many of us can say, okay, it's 10 p.m., everything closes now. Phones away, phones off, or phones on silent. I'm going to get sleep. I want to get 8 hours. I want to get 7 hours. I want to get 6 hours, whatever. But that structure is missing with a lot of us. And everything matters. If you don't get enough sleep, maybe you get only 5 hours a night. When it comes to the things you've promised yourself to do the next day, you will find that those things are exponentially more difficult. You will find that if you tell yourself you're going to do 30 push-ups, 30 squats, 30 sit-ups in the morning, because you only had 5 hours of sleep, and that sleep wasn't even deep sleep, you might find it very difficult. You might either not do it at all, or if you did it, you would absolutely struggle to do it. So everything works together. That's the reason why all the slides and all the information that Dr. David, Ms. Jovita, and myself, there's a reason why all those slides are so similar, is because we're generally singing is one message. It's one thing that we're saying to everybody. Is you have to balance it all. You have to balance physical activity. You have to balance your spiritual life. You have to balance your mental life. You have to balance your sleep, your rest, your recovery, all these things. That is when your body actually changes and adapts for all the things that you've been doing during the day. So if you've been working out really hard, but if you're not sleeping or resting enough, the actual effect of all these things will not show on yourself as soon as you want. So cultivating mental resilience, Dr. David mentioned that as well. I'm going to skip past that. And then here, the lifestyle choices that you make. Also, both things were mentioned by both Mr. Leader and Dr. David. Reducing alcohol intake or stopping it completely. If it's something that you cannot stop, reduce it. You can reduce it to a time frame because I'm going to have a drink on the weekend. But also distorting the kinds of alcohol that you have. I'm really about realistic approaches to things. So if it's really not realistic for you to completely stop alcohol, no problem. But how can we structure it? How can we make it work for you? So if it's about changing, going from hard liquor and we're changing it to wine. We're going from 40% alcohol content to 11% alcohol content. We're changing you from drinking every other night or every weekday to drinking only on the weekends. Okay, we're drinking only on Sundays. Okay, now we're drinking only a glass of wine on one meal on a Sunday. Okay, now we're only going to have a drink when it's at a special occasion. When it's someone's birthday, it's a toast to somebody graduating, some kind of ceremony. Those are the ways you can structure things to work for you. Because that's one thing I've noticed with my thousands of clients that I've trained over time is when something is not realistic for them, they will not stick to it. So diet plans, fitness plans, they will not stick to it if the parameters go beyond what they feel is realistic to them. Somebody who is not a morning person naturally, I start telling you I want you to work out in the morning, it's not going to work for you. You might do it for 1 week, then you're going to quit. So people like that, you have to listen to. It's your responsibility to know yourself as well as an adult. You know, and then we work in line with those things, strengthen all those things. Preventative care, Dr. David mentioned this as well. Places like EHA clinics and eHealth Africa will put this excellent forum together. Preach preventative measures, getting checkups. You will not, some things do not show signs, like Dr. David said. They do not show any symptoms, any signs at all. You think you're fit as a fiddle, and you're really not. The only way you're going to know is by doing regular checkups to find out all these things that are going on with your body. And a holistic approach. All these things I also mentioned before. Making sure you take care of your mind, make sure you take care of your body, make sure you take care of your spirit, all as one key. Okay. So I mentioned about the dashboard, having a dashboard of your own life. I'm also going to talk about structure. Essentially, all of us grew up with some semblance of structure. Like I said, we were woken up at a certain time, we were sent to bed at a certain time, we were given meals at a certain time. Those of us who went to boarding school, secondary school, everything was regulated. And you find that you were healthier when you had that kind of structure. But like I said, once you become adults, everything becomes haphazard. Only when you are hungry, then you have a meal. Only when you get to sit down, then you have some food. Only when you have finished watching these TV shows and finishing work before you get to sleep. Everything is scattered. Your body doesn't know how to respond to you. And you find, I've had thousands of clients, like I said, who will tell me, oh, I'm doing all these things, but I'm not seeing the results. It is true that they are working hard, but a lot of the time, all these factors around, or this lack of structure is what allows your results not to show the way they're supposed to. So even if you had a conversation with your instructor said, in 3 months' time, you should look in a certain way, or you should have dropped down to a certain size. If you're not controlling all these experiencing factors and this lack of structure, that timeline will be exceeded. And what happens to a lot of people, they get greatly discouraged when that timeline gets exceeded, and then they stop altogether. And that's a big mistake. All those things need to be tuned in, structure doesn't need to be put in place. I'm looking forward to the Q&A. I already answered one question about eating and about calories in and calories out. But we'll dig deeper into all those kind of things in the Q&A section. But my message today is to be more like a child. All those things that you did more as a kid, when you had real meals and your treats were only little, that's what you should be striving for. When you slept longer and better, you should be striving for that. You didn't have access to a lot of all these technological things when you were a kid, you should strive for that. You should put these things away. Especially phones, they can be so distracting. They can be a real aid, but they can also be a real weapon against you as well. So strive to make all the technology around you your own weapon for your own progress. So there's apps to remind you to drink water. A lot of time, a lot of us are dehydrated. It's been really hot. Those of us who are in Nigeria listening, it's been very, very hot lately. And a lot of us have been dehydrated without realizing. Maybe only if you go to the toilet, you realize your urine is really dark. Then you might, oh, I must be dehydrated. And all these things come with headaches. They come with lethargy. You're feeling really weak. So you have to drink as much water as possible. If you notice in the EHA video clip that started this whole webinar, the gentleman there said he drinks over 2 liters of water every day. And that's a very, very good target. So there's apps you can download that can help you keep track of that. There's apps you can download to help you keep track of your sleep. There's apps you can download that you can use as timers, so you can do your workout 10 minutes only, but do that every day. There's apps on your phone to track your movement, how many steps you've taken in a day. You can simplify these things and you can use this technology to help you. And that's what I'm saying. I want everybody to take that away, is find the easy ways to break all the excuses that you have made over time, because we all do it. We all make excuses to not do what we're supposed to do. We all wait for the things to go wrong before we start to address them. We all wait to be, a little bit embarrassed by something. There's a dress you've always worn, all of a sudden it doesn't fit anymore, and that's your shocking moment. It doesn't have to get there, but even if it does get there, my message today is to use all these things that technology has gifted us with as a means to make physical fitness progress for yourself. I had one more point to make. Yes. So actually, I was going to give a brief sample. I'm sure most of us have sat down watching this, but if any of us can get up, I'm actually going to do a little sample of something you can do in the morning. I will take you nothing less than like just under 5 minutes, and use that as a starting point or a foundation for yourself. All right, are we ready? I just need a thumbs up.
Okay, yes.
Already. All right, great. All right.
Yes, we are.
So this first thing is just simple, is jumping jack. So my legs, you can't see my legs right now, but they're opening and they're closing, all right? And I'm using my arms as well. So I'll do it in slow motion so that the camera can catch me. It's this and this and this and this, all right? And I'm landing on my toes.
Do you want to stop sharing your screen so that we can see?
Oh, okay, yes.
So that we can see you. Yes. So that people can see you, those watching on LinkedIn. Yes.
Ah, right, yes.
All right. Great.
So in slow motion so that I don't go off, the background, this is what's happening. And like I said, my feet are coming together and coming apart. But in real time, we'll be going faster. Go as fast as you can. Put a little timer, do that for 20 seconds. Then you have a 10-second break. I want everybody to take note of this. 20 seconds of jumping jack, and a 10-second break to catch your breath, because you will find that your heart rate just elevates and you start breathing a deep sigh. The next one we're going to do is just going to have this wide stance, and you're just going to act like you're punching all your problems away. Just throwing punches. So if you've had a really terrible day, maybe your boss has been mean to you, or it's just been a hectic day, a colleague annoyed you, family member annoyed you, you can use that opportunity to think about this and punch your problems away. So I'm punching and I'm punching and I'm punching. And for every punch, I'm taking a breath. I'm exhaling. I'm doing that for 20 seconds again. Then I take a 10-second break. So those exercises, those two were focused on my upper body. So the next two I want to do, I want to be focused on my lower body. So I'm going to take a wide stance here. Like I said, I know you can't see my feet, but I take a wide stance with my feet just outside of my shoulder width, and I'm just going to act like I'm sitting down. Squatting, down, and up. Okay? So that's focus on the lower body. Then I want to hit the midsection now. Very, very simple with the midsection. Just have my elbows up. I lift my knees up to the opposite elbow. Like I said, go as fast as you like or as slow as you want. 20 seconds, all those 4 exercises, 10-second break in between, and just keep repeating that until 4 minutes is up, and then you're good. So if you cannot do that, if you cannot commit 4 minutes only, then you're just doing yourself. And I don't want anybody who's here today to get towed away in an ambulance or anything like that. You know, it's nobody should be towed away. Look after your body. It is yours. You're only giving one body. And people say a lot of things. It's all those excuses to not do what you're supposed to do. Everybody says, all these ones won't matter in heaven. Fat is fat, I don't care anybody. All those things are just excuses that we give ourselves to not do the work. The point is, it doesn't have to be difficult. We need to switch our mindset. Stop thinking of it as a chore. Just think of it like brushing your teeth. I brush my teeth every day, and I've got to do this exercise every day. I just got to move. And you find that you feel so much better when you're actually doing the rest of the activities for the day. You have a bit more mental clarity. You feel a little bit more pumped. Your concentration is better, and you just feel better. And you see people start to notice, like, are you doing something different? Your posture improves. You might decide to make other decisions like, okay, maybe there's elevators in your office. You choose to take the stairs instead. That's your own contribution to yourself. Like, you know what, this is for my body. Because I'm going to be sat down for 7-8 hours anyway. So I might as well do this thing. So let's make all these choices that improve our own physical health. And they don't have to be complicated. Everything very simple and just very, very, very short. And you'll be impressed with yourself, with the compounding positive effects of these small choices. Thank you very much.
Thank you very much. Please, let's just give a round of applause to all of our speakers this morning. It has been an insightful session from all of you speaking to us today. You know, while you were speaking, I could see something in common with all the speakers. It's the power of habits and on our health. You know, when you do something, you've done something for 30 years, 40, 50 years, it becomes a pattern. And that's why people find it hard breaking away from unhealthy habits. So while you're speaking, there's a book called Atomic Habits by James Clear. It's a book that I would recommend for anyone if you want to really understand the science behind habits, the reason why you've been unable to break away from certain patterns, you know, and what you can do. You know, while you were speaking, you had made mention of using an example of someone who drinks and how they can say, okay, I'll drink at a specific time of the day. And then gradually they can say, okay, I only drink on Sundays. And then gradually they can say, okay, I'll only take a glass of wine with dinner, and then gradually it can shift to being I only drink during special occasions, you know, things like that. You see things like habit stacking, you know, and all of that. So Atomic Habits by James Clear. You can Google it, read summaries of it, and you know, you might get 1 or 2 important things. So I'm hoping that we can round up in the next few minutes. So that means for each question that we give to the panelists, please, I'd like our answers to be as short as possible and straight to the point so that we can save some time and get on with the rest of the day's activities. So the first question I have here, I think this will go to Jovita. The question says from Tijani, says, please give us an example of at least 3 balanced diets, food types that are available locally. I can't hear you. Still can't hear you.
Hello, can you hear me now?
Yes, we can hear you now. Yes.
Okay. Okay. Talking about a balanced diet, I want to go straight to the point. Like I stated earlier, there is no 3 class of food or 3 class of nutrients. There is balance on its own. So making it balanced, you have to encompass the 6 classes of nutrients. Like I stated earlier, the protein, the carbohydrate, the fats, and oil, the vitamins and mineral, which comes from the fruits and vegetables, okay, and water. So that is what comprises a balanced diet. So there is no 3 food that can come up on its own and make up a balanced diet, except it comprises of all these 6 nutrients. Thank you.
Thank you very much, Jovita. I think this will go to Dr. David. While Jovita was speaking, she talked about sodium and the quantity of sodium that should be in the body, and the quantity of sodium in the cubes of Maggi and some other things. So someone said, talking about sodium and potassium, when diclofenac tablets is prescribed to me, it is always diclofenac sodium, and they will ask me if I have ulcer, which I have. So I always take diclofenac sodium. So I think this person is talking about, drugs that also have sodium, how appropriate it is to take those, considering what we've talked about today. So Dr. David, can you just shed some light on that?
Okay, thank you very much for the question. So for the diclofenac sodium, whether it's diclofenac sodium or diclofenac potassium, okay, the quantity of sodium and potassium are usually negligible, and it's to aid transport, okay, of the main constituent of the drug into the bloodstream so that it can do its work, right? So what you should be concerned about is the diclofenac, okay? What you should be worried about is how frequent you take that, okay, because it has a side effect. The side effect will most times come from the diclofenac itself, right? Not just the additive sodium, potassium on it, okay? So you need to limit that. If you take it too often, that may be the reason why you have the ulcer you're talking about, right? You should only take it based on prescription. And even if you have the ulcer, it's advised you cut down. You should have other alternatives to the diclofenac sodium. So please, whoever asks the question, please, if you're taking diclofenac sodium all the time, that may be the reason why you have your symptoms. That may be the reason why you have your ulcer, okay? So use other alternative pain relievers, okay? Not to worry too much about the sodium and potassium level, like I said, it's just to be transport of medication. If you have ulcer, please cut down. Thank you.
All right, thank you very much, Dr. David. This question was put on the Q&A box, but I want to ask it again so that people also on LinkedIn can get information. So this person was asking, this question is for Mayoko. He says, will your fitness exercise have effect if after exercise one goes in to eat heavy meal, but you're still consistent with the exercise? So she's asking if I'm consistent with the exercising. Is it an excuse for me to eat junk, eat whatever I want to eat, just consume anything? At least I'm exercising.
Yeah, so you'll be surprised at how often I get that question actually, and a lot of people actually practice this. The thing is, I never want to discourage anybody from, if you've built a habit of working out consistently, that's a great thing. You already stand a better chance than most of the people. But if you truly want to get the results that I'm assuming most people want, which is weight loss or weight management, you can't go ahead and start having heavy meals right after the workout, because everything obeys one fundamental law, which is for you to lose weight, you must expend more calories than you ingest. So the amount of calories you burn while exercising must be more than the calories you take in when you're eating. I mean, we can go deeper into good calories and bad calories, but the point is, if you actually want to lose weight, you want to make sure that you're in that deficit of calories. And if you're trying to put weight on, then the calorie surplus. So, or if you just want to maintain, you want to just everything to be neutral. So it depends on what goal you're trying to achieve. But it starts to feel counterproductive if you're working out really hard, you're so intense in the gym, only for it to be stacking bits of heavy meals and starch into your system right after that. You're going to end up disappointing yourself and getting discouraged anyway, and then you might end up stopping the exercise, which you don't want at the end of the day. So I would suggest and I would advise, my own professional opinion, that you actually take care to have more nutritious meals after your workout, especially focused on protein as opposed to carbohydrates. And we have a lot of these things around, here in Nigeria, a lot of good, protein-filled meals that we can have as opposed to having heavy starchy meals after the workout.
All right. Thank you very much, Mr. Mayoko. The next question is to our dietitian in the house, Dr. Jovita. So someone is asking, is there any health benefit of eating combined fruits as in fruit salad? Is it true that watermelon shouldn't be eaten with any other fruit as we have in fruit salad? And I'll just combine it with this question. And someone is also asking that what do you think about taking supplements versus eating healthy? Can supplements, supplement for your normal food? Maybe when you don't have access to some certain food types, can you bridge the gap by taking supplements?
Okay,
all right, so
for the questions, let me first answer the first one. Okay, the one that said, can watermelon be taken with other fruits, right? Okay, watermelon or every other fruit can be taken with every other fruit. Okay, let's be specific with watermelon. Reason being that is a fruit, unless there is a reason for an exception. For instance, you're allergic to watermelon. Maybe someone is allergic to watermelon. It can be restricted. That's one of the reasons. Or for critical cases like diabetic patients, in as much as we recommend fruits, but there is a certain range that your blood sugar level will get to. We restrict. It will be total restriction for fruits. Okay, so there are special cases whereby we restrict food. Fruits rather, and watermelon is one of those fruits that can be restricted depending on the person's disease condition. But aside any allergy, aside any health condition, watermelon is okay to take. And then asking whether you can take whether it's good to mix fruit salad. Of course, is healthy. Like I stated when I showed a pictorial graph of a picture representation of how a place should look like. I said the more colorful it is, the better it is. That means variety. And I started eating varieties of fruits and vegetables. So eating the variety simply means you are getting more nutrients. Okay, what do I mean by that? For instance, orange is rich in vitamin C. Okay, and then cucumber is rich in every other nutrients, vitamin C, vitamin E. But orange is nutrient dense in vitamin C. So when you're eating orange and you're eating any other food like banana, which is high in potassium and also high in vitamin E, you are just boosting up your nutrient intake. So it's advisable you take a variety of nutrients, a variety of fruits. So that's basically about it. Then about if you can replace a healthy meal with supplements. No, the answer is no. Reasons being that a supplement simply means addition. That supplement means addition. That is what a supplement means. Okay, so supplement simply means most times we recommend supplements for people that are not getting an exact nutrient that we want. For instance, some hypertensive drugs comes in, they have potassium content in it. And some other, like maybe pregnant women, we recommend folic acid supplement. Reason being that they might not be getting enough folic acid from the diet, but that's not going to replace the meal. we'll still encourage them to take adequate nutrition. Why we recommend supplements to add up to whatever nutrients that we see, maybe through the biochemical investigation that we've seen that, oh, this nutrient is low, maybe the potassium is low, magnesium, any other nutrients we feel is low, or that we feel that we need in high quantity that the body might not be able to produce and we might not get it enough in food. So we recommend supplements. So supplements cannot replace diet. Thank you.
Thank you very much, Jovita, for that answer. The next question I have, I'm taking from LinkedIn. It's for Dr. David, and someone is asking Kata Bitcoin Akudo. She's saying, do we have unhealthy proteins?
Sorry, come again with the question.
So she's asking, do we have unhealthy proteins?
Okay, do we have unhealthy proteins?
Yes.
Okay, protein is a class of food. Am I able to here as a dietitian?
I think I should take the question. That's why I omitted that. I think it's
okay.
best.
Okay.
I think that was one that mentioned
yes. Unhealthy proteins.
Yes.
All right.
Yes. The question is, let me get your question. You asked what are the unhealthy proteins, right?
Yes. So do we have it, and what are unhealthy proteins?
Of course, we have unhealthy proteins. Like I stated earlier, for instance, beef, which is gotten from cow meat, is a protein. Is a healthy protein, but it becomes unhealthy when there is visible fat. For instance, when you start taking offals like organ meat, shaki roundabouts, all those ones we all know. So that is an unhealthy part of the meat. It's a protein, but it's an unhealthy part because it's high in saturated fats. So these are the places where you say this meat is unhealthy. And you want to take the flesh of cow, which the one we call red meat, you take the ones that is lean in the sense that there is no visible trace of fat. In as much as it still contains fat, whether it is visible or not, but taking the lean one where there's no visible part of fat, you're not seeing it, is more healthy. It makes the meat healthier. Thank you.
All right. Thank you very much. I think we still have another, there seems to be a lot of questions around, diet. So someone is asking, as touching sugar intake and consumption reduction, you had mentioned that 1 glass of sugar per day is what is recommended. So she's asking, is this also applicable to homemade natural juice? Is it just processed sugar or just sugar in general?
Sorry, can you ask the question again so I can understand better?
Okay, so while you were speaking, you mentioned that, did you mention that 1 glass of sugar per day is recommended for, you're talking about when you take juice, that you should not take more than 1 glass of sugar, 1 glass of juice.
That's one glass of fruits, not sugar.
Of fruit juice.
Oh, okay.
Yes. Okay. All right. So that's a correction. 1 glass of juice is what is recommended.
Of fruit juice. Homemade fruit juice, not processed fruit juice. Thank you.
Okay. So that means you cannot use the fact that it's homemade fruit juice to take 7 glasses because it's natural.
No. In as much as it's natural, it's sugar, so it's going to definitely add to your weight.
Okay.
So it's still a sugar in as much as it's natural.
So you can hear it, even though it's natural, it will still add to your weight. It's not an excuse to finish, 3 jugs. All right. So someone is saying that Mr. Okunu should make a small video. I guess you could do that much later so that they could see just your upper body. So I'm guessing you can do that and put it on your social media channels that people can watch. So I guess this brings us to the end of this wonderful conversation. It's been great listening to the experts talk about our health from the angle of physical fitness, from the angle of our diet, and general health. And we've been discussing my health, my rights. For the people that are watching us on LinkedIn, thank you for registering for this webinar and being a part of this conversation. We believe that you have been able to learn, gain insight that you can take away even into your own personal life, and also even share with friends and family. Thank you very much to our panelists, Jovita, Dr. David, and Mr. Olumayoko. Thank you very much. My name is Tijesu, and with this, we have come to the end of this webinar. Remember, health is wealth. Make your food your medicine, and your medicine your food. Thank you very much, and let us have a wonderful rest of our day. Thank you all.
Thank you all.